Hello everyone, welcome back to another video on acne awareness. So as discussed in the live, I will be taking you through various acne case scenarios and talking to you about the treatment options available. So let's see what we have today. So today's case scenario is cystic acne. So let's hear from the patient about his acne history.
Hi, this is Harshit. I had acne from before also. From past 6 to 7 months, it is generating more because of usage of mask regularly.
So let's take a closer look and analyze the lesions the patient is presenting to us with. So he has a few cystic lesions that he says are very painful. He has a few pustules and lot of inflammatory lesions all around here, and post-acne pigmentation, that is PIH. So we see PIH, we see few lesions that are resolving, we see few cysts and few pustules. So basically this is a case of inflammatory acne, and as per his history, the acne has aggravated because of continuous use of mask, which is why you see how the distribution of acne, it's mainly on the areas where the mask can come in contact with the skin. So he also has few acne on his forehead and the temple area and all over the face in general, but predominantly the lesions are on the area where the mask is rubbing against the skin surface. So now what are the treatment options available in this particular situation and what should be our approach? One good thing is there's not a lot of pus or infection associated in this case. So there is no need of giving any antibiotics in this case. So that's taken out of the situation. Now what do we need to do to reduce the inflammation? So the whole treatment should be here to reduce the number of cysts he's having, to reduce the overall inflammation that is there under the skin. First thing is, because he has, now let's look at the triggers, right? So he's talking about maskne here. So the first thing is to talk to him about the mask hygiene. So you should be very careful when you're using your mask. So once in a while, so throughout the day, if you're wearing mask for a long time, once in a while you take your mask off when it is safe, when you're not around people, and wipe the area properly, keep the area free of sweat, and make sure that you wear skin friendly fabric masks. Okay, so try to wear cotton mask. You can make it like multiple layers, so the breathability is also fine and the absorption of sweat also happens. So because see, now also if you take a closer look at the area around his nose and on the upper lip, there's lot of pus-filled lesions and redness around that area because there's inflammation in that area. So he also has seborrhea going on in that area. There's a lot of oil, sweat accumulation in that area, so that area feels very inflamed. And if you're wearing, when you're wearing the cotton fabrics, make sure that you put it for wash every day, and make sure you wear 2 masks in a day at least, reusable masks, so that you can put them for wash. So the first thing is to address the underlying triggers, which we have done here, because he says there is an aggravated, the mask is triggering his acne, which is obviously seen on his face also. So after that, what are the other triggers he could have? So try and address that. So probably look into his diet, do the diet modification. So we also have like a DNA acne diet chart, in which we mention the foods you can consume comfortably, food you should be consuming in moderation, and foods you should be avoiding. So then coming to the treatment, what should be our approach? Like I said, since there's a lot of inflammation and there are a lot of cysts in this case, my approach would be to go in with oral isotretinoin therapy. Before I put him on oral isotretinoin, since he's in the clinic and he's a very hard to get person because of his schedule, I would start off by doing the peel called DNA BB treatment. So what is DNA BB? As most of you know, it's break up with your breakouts. Why am I doing this peel? Because I want to give him, as much as possible, I want to clear his acne with the peel, because when we put them on oral treatments, it's going to take some time for the system to take these ingredients and act on the skin. So it's going to take some time. So in the meantime, I want his peel to do some good to him. So I want his, when we do this peel, the dead skin cells and all start to give away, and the accumulations will start to seep out. So the inflammation is going to come down, and in the meantime, the isotretinoin is going to start functioning. So we are going to give him results, or give him result oriented treatment from the day 1. So first I would start off by doing DNA BB. That's a single session procedure, followed by which he will be starting to take oral isotretinoin from tomorrow. So along with oral isotretinoin, we will also be giving him certain topical medications, topical creams, lotions, face wash, that will complete his acne protocol. So let's slightly deviate from this patient and look at other probable scenarios that we can have in similar situations, right? So if there is a woman who is approaching us with severe cystic acne, we would also want to analyze various other aspects. So we would also like other triggers, any underlying hormonal imbalance, all of this would be analyzed. And in those particular patients, we might have to give like oral isotretinoin or oral contraceptive pills, spironolactone, all the other medications that would probably put her hormones in balance, control her oil secretions also. So again, like I said, it's always a very individualized, personalized protocol depending on the type of acne you have, depending on the triggers that are causing the acne also. So for him, after his evaluation, we are not putting him on any other medications except for oral isotretinoin here. So what would be his topical treatments that we are going to put him on? So now when we do the oral isotretinoin therapy, in about 4 to 5 days, his skin would start to become very dry. Patients will complain of dry skin, feeling like the skin, they feel very itchy, and the dryness can be as severe as having cracked lips also. There could be fissuring and cracking of lips also in some patients when we start oral isotretinoin therapy. All these things we will counsel the patient and keep the patient prepared. It's very, very important to counsel and talk to patients and to keep them prepared, because the dryness can be so severe that the patient cannot tolerate it. So if we keep the patient or the client prepared, then it is easy on us when we go ahead in the treatment also. So because he has a lot of dryness and sensitive skin issues, that can happen with oral isotretinoin therapy. And sometimes when we start all these treatments, there could be sudden outburst of acne also. So that can also be observed. So once we start you on the treatment, you could observe that your acne, you find that there's a lot of acne coming out all of a sudden. That's also normal when we do these treatments. Okay. So now when I'm doing this, because his skin is already getting sensitized, I wouldn't put him on any other actives or creams and lotions that can further sensitize his skin. So what are we doing when we put him on oral isotretinoin therapy? The first 1 week to 10 days, the only focus is to nourish and calm his skin, because it's already in a reactive state. So we would be giving you only a very nourishing, gentle face wash and good moisturizer and a sunscreen. These are the only 3 products that I would be personally giving for a client on isotretinoin therapy for the first 1 week to 10 days. So now let's look at the products that I commonly use in this scenario. So when it comes to face wash, my go-to face wash when it comes to like treating a sensitized skin or skin in reaction is Ederma Soothing Face Wash. And when it comes to moisturizers, you have Cica Bio, we also have Sebium Hydra, and the other moisturizer is Epithelia Hedge. This is one of my again go-to moisturizers while treating sensitized skin. These are all the products that are available easily and in the affordable range. You also have Zedo Skin Health Hydrating Cream. This is excellent for hydrating sensitized skin, but again this is slightly on the luxury side. But the first 3 products that I've mentioned are more towards the affordable range. So now we have crossed the bridge. We have crossed the 10 days of isotretinoin, 10 or 12 days. It depends on again individual patient. Sometimes it take about 10 days to recover from this scene, and some people require a little longer time. So once we have crossed this stage, once the skin is back and is adjusted to this oral isotretinoin treatment, what do we do now? Now is the time we up the game when it comes to the topical application. So morning, it's a gentle nourishing face wash, which is followed by a serum. It again depends on the condition or the concern of the client, and also affordability and also interest. Like people don't want to do more than 2 or 3 steps in their skincare routine. So keeping all these factors in consideration, we end up giving a good face wash followed by a niacinamide based serum or vitamin C serum if there's a lot of pigmentation also associated, and followed by a good sunscreen base that will suit the skin type of the patient. So here we give photoprotector Isidin. It's excellent water based sunscreen, and it sits really well on the skin, and you don't have to do too many strokes, or too much of rubbing is not required when you're applying this particular sunscreen. So it's very easy to apply as well. So that's something that I would end up giving in this particular scenario. And we have PM routine. Now for evening, we give him a salicylic acid based face wash. Again, salicylic acid based wash or other actives will come into picture after the sensitive period with isotretinoin is crossed, right? So evening we give him salicylic acid based face wash, followed by now since there is a lot of inflammation, erythema associated with the acne, putting a retinoid based cream is a must in his protocol. So followed by the evening face wash, you will end up applying a good moisturizer, followed the sandwich technique, right? You apply a moisturizer, then apply a retinoid based cream. Again, layer it up with a good moisturizer. This is going to be his evening protocol. And through the day, depending on what lesions are coming up, he will end up using spot treatments that will have ingredients like benzyl peroxide, adapalene, clindamycin in various combinations, all depending on the lesions he's presenting with. So in case after we do the peel and after oral isotretinoin, he doesn't have any pus-filled lesions or he doesn't have any new lesions popping up, then he will not use any spot treatments, obviously. But if he has a here and there like a pus-filled, for example, if you take a look here, if he has this pus-filled lesions, he might have to end up using a topical, like local application of Deriva CMS ointment that I have linked here that has clindamycin and adapalene. So those are the spot treatments that go into treating this particular case. And coming to weekly treatments or the alternate day treatments. When we treat this patient with the salicylic acid based face wash, retinol based creams and spot treatments, all of these things that go on a day-to-day basis, there are certain things like oil control pads that we give in this particular set of patients. What will oil control pads do? It can do both physical and chemical exfoliation. So when initially we start off by asking the patients to do it once in a week, then gradually progress it to twice a week and 3 times a week. And if the patient's skin is able to tolerate this product well, then we ask them to do it every day and even sometimes twice a day if there is lot of excessively oily skin and there's a lot of like environmental pollutants, exposure to environmental pollutants. We also end up asking them to do twice a day, but that's slightly aggressive. So once a day is good enough. So oil control pads, you can use it as AM routine or PM routine depending on his convenience. So that's something that you do alternate days or every day also. That's one oil control pad you need to take and rub it off on your skin evenly, focusing mainly on the acne prone areas. But in his case, the mask area, right? So we ask him to give more strokes on the acne prone area and go easy on the rest of the face. The same thing holds good with salicylic acid also. When you're using a salicylic acid face wash, try to spend few extra seconds on the problem areas and run through quickly on the rest of the area so you don't end up having dry skin issues end of the day. So that's one thing. The other thing is, we give home peels like home glycolic acid peels or home salicylic acid peels that you have to do once in a week or once in 10 days or sometimes twice in a month. So how many times you have to do and how you need to do will be told to you when we give you the protocol personally. Because again, weekly or once in 15 days, it highly depends on how your skin is there at a particular point. So along with all these, we also end up giving you some medicated masks. So these masks will help in unclogging the pores, to reduce the overall oil secretion on the skin and to calm your skin as well. So there are different kinds of medicated masks available. We will be giving you the mask that we will be giving you will be based on the presentation that you present to us with. So yeah, that's basically the protocol for this particular patient. So to summarize, it's isotretinoin based treatment. We would be giving him isotretinoin. So to begin with, we give him for 2 months and then we see how things are going and then we sort of taper it, or how the continuation of isotretinoin will be depending on how he's presenting to us after 2 months. And then topical treatment that is mainly targeted to reduce the inflammation on his skin. So the ingredients that we are using will be salicylic acid, benzyl peroxide, clindamycin, adapalene in various combinations. And we also, to take care of the dead skin cell accumulation, we also give him products that will help in both physical and chemical exfoliation. So the idea here is to keep the oils under control, and since he doesn't have a lot of pus-filled lesions, we are not relying heavily on any antibacterials here. So now, other than this, what are the instructions you give to patient, or what's the care you need to take at home, right? So one, stop picking your pimples. Do not pop your pimples out. That's a basic thing. You must have heard it over thousands of times, but still people end up doing it. So don't pick on your acne. One, change your pillowcases as frequently as possible. Maybe alternate days is also a good idea, because you have oily scalp, you also have dandruff, and you have seborrhea on the skin also. So changing your pillowcases frequently is a very good idea. And what are the home remedies you can indulge in and what you shouldn't indulge in? Do not put lemons, toothpaste, garlic, or any of these flavorable ingredients onto your skin. What you can use though is aloe vera. You can take freshly squeezed aloe vera, maybe just add a little bit of turmeric to it, apply it as a face mask, leave it on for about 3 to 5 minutes and rinse it off. That's good. Along with that, the other care is like follow the protocol that we have given you. Wash your face as instructed. Take care of the oily scalp as well. So we're putting you on anti-dandruff treatment also. So take care of your oily scalp as well. Now, if there is a situation where you suddenly, you're exposed to hot or humid climate and you start sweating, make sure you always carry a clean cotton cloth and dab off the excess sweat. And if you're continuously getting exposed to direct sun rays, make sure you reapply your sunscreen. Okay, and while on isotretinoin therapy, there's a whole list of instructions we give you with the treatment protocol. Please adhere to the instructions, because while you're on isotretinoin therapy, your skin is very sensitive and you need to make sure you protect it to the maximum possible. Also make sure you use cold water or room temperature water to wash your face and avoid using excessively hot water. And also do not rub your skin with the towel, just dab the water off with the towel. Do not excessively rub your face. So I hope this session was informative. If you have any more queries, please put them in the comment section below, and you can reach out to us on info@dnskinclinic.in. Thank you, stay healthy and stay happy.